BD, Bestpac.
Yeah, Owen Mumford. I mean, the Humira device is a big seller. I don't have the numbers, but I imagine there's a lot of those being sold. That's AbbVie product, Owen Mumford device. I guess the EpiPen, which is Mylan, sell that. I think Meridian is the company who make that. Big numbers there, and then a number of smaller ones as well.
And you said EpiPen is around 10. Okay, fair enough, right? So would it be fair to say that, so we have 60% SHL and Lilly, and maybe with EpiPen we have another 7-10% with Meridian, right? So we have 30%, and we have some ON, so maybe another 10, right? So we have 20% left to allocate, right? Would it be fair to say that maybe those go to BD and Bestpac, maybe?
Yeah, mainly, plus a bunch of other smaller ones.
Okay, fair enough. I mean, this is not scientific, right? But this is useful.
Yeah. No, I think it's a good it's a good estimate. Yes.
So, tell me about Trulicity a little bit, actually. Because I think it's a bigger dosage, right? A lower frequency drug, correct?
Not sure. Once a week, I think, which is pretty normal.
Is it normal? I thought this was. I thought typically it was less. No.
Well, this I guess is for auto-injectors. No, I guess for a diabetic patient, yes. I mean, they're used to injecting with insulin, of course, many times a day. But the whole advantage of GLP-1s is it's typically a once a week dosing. So that I mean, I'm not a medical expert, but I understand that's one of the advantages of this type of therapy. I mean, there are other GLP-1s as well out there, but this is fixed dose, which I guess it makes it very easy for the patient. Then they don't have to, no dialing of a dose or anything like that, which there are with other medications. So
maybe it's a stupid question. I mean, as you can tell by now, probably. I mean, I have plenty of those. Is this cannibalizing insulin, right? GLP-1 essentially, right? It's is it taking volume from that, right? So is there a cap in your opinion? So when I think about 100 patients, right, that are some on injection, right? So let's ignore diabetes patients, I should say, yeah? So I'm ignoring the guys who take oral medication, right? And I'm ignoring the guys who just diet or do exercise, right? So we're left in the world of guys who took insulin, right? So now there's a percentage of those who take GLP-1. That GLP-1 percentage may grow over time. Do you think there's a cap? Or is there a scenario where all insulin injections could be replaced by GLP-1? I'm just trying to get my head around this GLP-1 thing.
Yeah, I'm not. So I'm not an expert here, but I don't think so. No, and I think this comes down to as well. Type 1 and type 2 diabetes have quite different treatment regimes. I think for a type 1 diabetic, then they'll need to inject insulin, and that won't change.
Got it.
Type 2, yeah. I mean, there could be. As I understand it, the market unfortunately is growing at such a rate that some of these trends are a bit subtle to find in amongst all of the overall growth and development of those markets.
Okay, and maybe one last thing on this market trends, especially GLP-1. Are you familiar with I know it's not your domain of expertise, you mentioned it, so feel free to push back, but have you heard about oral GLP-1?
I've heard of them, yes.
And do you know if this is a real thing and whether it would take over and replace the injections, right? I'm just, again, trying to get my head around that.
Yeah, my understanding is no. Again, I'm not an expert here, but as I understand it, most of the GLP-1s are not very orally bioavailable. So if you take them orally, then the drug mainly is not absorbed. So